What's up, everybody? My name is Maggie Reichart, and you are listening to Nursing Uncharted, the podcast that covers uncharted territory in your nursing practice. Thanks so much for listening to us today. If you work in a realm of nursing that you love and want to share with others, or if you're a nurse just with a story to tell, shoot me an email at nursinguncharted@amnhealthcare.com. I love talking with other nurses about this crazy job that we all hate to love to hate, all of the above. And so, yeah, send me an email. This episode is sponsored by AMN Passport. AMN Passport is a highly rated travel nursing app that helps you find, book, and manage travel nurse assignments all from your app, making it very easy to find your next travel assignment. If you're in the market for a next travel assignment, be sure to check it out. So today we have a really cool avenue of nursing to talk about today, off the beaten path type of nursing specialty, which if you're an old listener, you know that some of these specialties that I know nothing about are some of my favorite conversations to have. And we are talking about forensic nursing today. I'm sitting down with Leah Helmbrecht. She is a forensic nurse examiner and sexual assault nurse examiner. She has an Instagram at Off the Clock Nurse, where she educates people about the specialty. She provides support and advice about toxic relationships, and she debunks myths and misconceptions about the specialty. So, Leah, welcome to the show.
Thank you for having me.
Yeah, it's so great to have you. I love your Instagram. You're a very powerful and influential person. So thank you for sharing your story and all of the tips and everything on your page.
Thank you. Yeah, it's definitely taken a turn because I used to be an operating room nurse and do travel nursing, and that's where it started. And now I do more educational on forensic nursing.
Yeah. Okay. So how long have you been a nurse? What's your background? How long were you OR?
Yeah. So I've been a nurse for 14 years, which seems like forever, but I've been thinking you still have 30 more years left to work before I can retire. Makes it seem like not that long. So 14 years, and I have worked almost everything. I feel like I started on the floor, then went to the operating room, then did travel nursing for 7.5 years in the OR. And then I've worked remote at the nurse advice line. I've done bone marrow transplants, and now I'm doing forensic nursing. And then I also work part-time as a discharge nurse for acute care floors. So
oh my gosh,
there's a little bit of everything.
Yeah. Well, that's probably why it just seems like it hasn't been that long, because you get little bits and pieces. I mean, you had a large chunk in the OR, but
yeah, I was in there for about 10 years and I loved it. But I don't know. I think with nursing, it's what's great is that there's so many different types of nursing, and it's not that I didn't love the OR. It was just, I don't know, when you kind of feel like you're becoming stagnant in something and you just want to try something different. So I'm pretty happy where I'm at right now too. So
yeah, that's awesome. And that's good for you for knowing that you needed a change and being comfortable to leave something that you've been doing for 10 years and try something new.
Absolutely.
I have also dabbled in a bunch of different things. I started out in med surg in neuro, and I did that for 2.5 years, and then I traveled for 4 years, and then I wanted to try ICU, so I came back and I'm doing ICU, and I've been doing that for the last 3 years. But yeah, it is if you do get burned out or tired in one thing, you can just figure out something else to do. And yeah, it's one of the beauties about having the degree is that, you can do so much with it.
Absolutely. There's an inpatient, outpatient, working remote. It's just never ending options.
Yeah. That's actually one of the things that I loved about traveling too, is that I traveled as a med surg nurse, acute care, and that kind of opened, you didn't have to just do bedside. You could do outpatient. You could I took breaks in between and was a summer camp nurse, or, I did care.com, just there's the world is your oyster, especially when you travel too.
It's a difficult profession, but I always recommend it for people just
Yeah.
because of the flexibility. And, if you can deal with bodily fluids, then, you can definitely be happy doing it. You just need to figure out where your passions lie. And
Yeah.
I've definitely found that
Yeah.
now doing forensic nursing.
Yeah. So talk to me about how you came to do forensic nursing.
Yeah. So I actually never knew that a sane nurse existed.
Mm.
And after I've left traveling and the OR, I actually tried out working as a travel nurse recruiter for a whole 5 months. It was very stressful. It was a very stressful job. If you have a recruiter that you really like, you should definitely thank them because it is not an easy job.
Oh man.
But while I was doing that, I had a nurse that had submitted her resume and it said sane. And I was like, what is that? And so I started
Should we
talking
put
to her
this on the
about it
resume?
more because I was like, sane, when you
Yeah.
see that, you're like, is that something psych wise or
Yeah.
what? So I started learning about that more. And then as we were getting into COVID, I started feeling a little more guilty about not using my nursing license.
Mhm.
And that's when I decided to quit the recruiting job and go back to nursing. And it just so happened that I did get a job at this nurse advice line. So I was still working remote, but we'd still take calls like COVID calls and other people having medical issues that were too afraid to go to the emergency department
Mm.
or, trying to figure out what they could do, if they could do something for their symptoms at home.
Sure.
And I noticed during that time we were getting a lot of calls from patients who had been sexually assaulted or those who were in domestic violence relationships. And again, they're too scared
Mm.
to go to the emergency room because of COVID. They didn't want to catch anything. They're like, what do I do? And the only
Mm.
thing that I knew about those two topics was what I had learned from Law and Order SVU, which I
Yeah.
can tell you is highly inaccurate. It's not, it's not real.
Yeah.
And so I was giving out really bad information. It was just like,
Mm.
oh, well, you shouldn't eat. You should take your urine with you. You should not bathe and do all of these things. And you have to go to the emergency room. Maybe you can go to the police department. You should report it. And all
Yeah.
of these things that were just not necessarily the best not the best advice to give. So
Yeah.
I decided, when I'm a little bit of a nerd, to where if I don't know a lot about something, then I kind of will go down a little rabbit hole on
Yeah.
Google and
Yeah.
find a way to get educated. And so I actually found a free SANE program, sexual assault nurse examiner program, that was all online through University of Colorado Hospital. And
Cool.
it was free to any nurse in Colorado. And it was all, it's what did I have to lose?
Yeah.
Something I could they send you the modules, I can press play and do it on my own time. And I
Yeah.
learned so much from that after I finished that program, I actually went further and did their in-class clinical that's down in Colorado Springs. And
Oh,
then
cool.
it just so happened right after that, I jumped on the job board at my hospital and they had a sane position posted there. It was almost like everything just kind of fell into place.
Yeah, that's
And I
what it
got
sounds like.
really lucky. And so I ended up reaching out to the manager and saying, hey, is this position open? And she's like, yes, please. When can you start?
Oh my
So I was like, I already
gosh.
finished the program. And she's like, yes. Do you
That's
have a
awesome.
therapist? And I said, yes. And she goes, great. When can you start? When can
Like
you start?
that's like
So,
a thing that you'd like need to make sure that you
well, it's
have.
not mandatory, but it was highly recommended. And that's what I
Okay.
also highly recommend to other nurses that want to get into this field, because
Yeah.
it's not easy. It's definitely not an easy thing to be in. So, having a therapist, either that you see regularly or just somebody that's on, on hold that you can reach out to, because some of the things you'll see, like we see a lot of traumatic things in healthcare,
Yeah.
but some of the things that you'll see and you'll hear and then going through the system can
Mm.
really, I don't even know the right ways to say it, but it's can make it very detrimental to your health if
Yeah.
you're not in the position to handle things like that.
Yeah. You have to be proactive about like
Mhm.
unpacking what you're seeing.
Yes, absolutely.
Yeah. Oh, I feel that. I'm sure. I mean, I think it's so important for all of us to have therapists, but I can't imagine having, I mean, it's interesting because like we all care for people that are in like, some of the worst times of their lives, but not so much in the most acute setting probably as you are. You might be like the very first person that these people have talked to about the situation. So like they're probably
Mhm.
still like it's a very fragile time.
Yeah. And honestly, talking with the patients is not the hardest part.
Mm.
Seeing their injuries, I mean, that it's horrible, but that is not the hardest part. I think the most difficult part of this job is actually trying to navigate the system. We
Mm.
live in a country that blames and shames victims, and that really keeps them from coming forward. And then when they do come forward, because of various reasons that people are just not educated on, they'll
Mm.
say, oh, well, you're lying, or I don't believe you, or, anything on that scale. And, and so, I mean, it's also a very hard thing to get a conviction for whatever reason. Also, juries, they don't want to ruin somebody's life by sending them to jail for maybe it was they don't want to believe that this actually happens, that
Yeah.
maybe it was just a misunderstanding, or maybe that person
Mm.
is overly dramatic, or all different kinds of answers, because it's
Yeah.
easier to believe that, make yourself believe that something like this doesn't happen, as to opposed to realizing just how prevalent it actually is here in the United States.
Yeah. And so like you're exposed to that as the nurse like time and time again, just like, you are the one that's like, do you follow the patients like through I guess like what is your involvement after, assessing and seeing the patient? Like how far do you go into the system?
Yeah, it's not so much. I guess it depends. It's case by case.
Okay.
As a forensic nurse, I'm actually only working PRN. So I work 4 on-call shifts. So when I finish with my patient, most often I don't get to see them for the rest, unless it ends up going to court.
Okay.
My manager is the one that follows up with everything.
Okay.
And I think it would also be, very upsetting to a lot of people to see how many go back to their abusive relationships. Although there
Mm.
are so many reasons on why people do.
Mm.
Um, but only about 2% of sex assaults actually will get a conviction. So
Mm.
already not very many will even go to court.
Wow.
So if I do end up following up, it's because I'm getting subpoenaed to go testify in court
Okay.
on the evidence that I've collected. Now, I can also be considered an expert witness by the judge, in which then I can be utilized to educate the jury.
Mm.
But it really does not happen very often.
Okay. Have you ever had to do that? Like, have you had to go to court?
I've been subpoenaed once.
Okay.
So, yes, I've been subpoenaed once, and it's they ended up actually taking a plea deal just before it
Mm.
started.
Okay.
So I haven't testified yet.
Okay.
But it is a whole process of them getting, prepping for court, and
Yeah.
getting ready for that. So
Yeah. Oh, I mean, as a medical person, I think like being a part of that like whole different realm would be like so jarring to me. But like, am I doing like, how do I like, what do I say? Like, how do I fit into this?
yeah, and you have to remember that I think a lot of people go into this field thinking that, oh, I'm going to get justice for this person.
Mm-hmm.
And then you have to realize that you're actually the unbiased person collecting evidence. And so when you do take the stand, no matter how you're feeling one way or the other, you
Mm-hmm.
actually just have to give the evidence
Sure.
just as it is.
Yeah.
You can't choose a side.
Right.
We do say start by believing those who come forward. That's like a big movement that's going on.
Yeah.
And that's important. It doesn't necessarily mean just believe that everybody was sexually assaulted all the way through. Let's convict people.
Mm-hmm.
And I think that's like a big misconception. What it is that believe people when they first come forward because there's no reason not to believe them.
Mm-hmm.
And you're not the jury, you're not the judge.
Yeah.
So your opinion on what happened really doesn't matter.
Right. Yeah.
So in my job, if I do take the stand, it is not to try and figure out what to say to sway the jury one way or the other. My
Sure.
job there is just to give facts
Right.
about what I've seen, what I collected,
Yeah.
and education on statistics that I know.
Yeah. Yeah. That's fair. That makes sense. So you talked about some of like the struggles that you've seen. Like what are some things that you love about forensic nursing?
I love that. I don't know if love is the best way to put it,
Sure.
but what I feel like I feel like with forensic nursing, like being a nurse for 14 years, I've been doing forensic nursing for almost 3 years. And I finally feel like I found something that is so meaningful. Not that
Mm.
any other nursing that I did wasn't, but when it comes down to it, when I see these patients, I'm usually one of the first people to see them after this, probably the worst day of their life,
Yeah.
um, being assaulted. And like I had said before, living in a country where we continuously blame and shame these people who were just assaulted, sometimes I'll be the only person throughout this entire system, throughout their community, throughout their friends or family who says, I believe you. And I'm so sorry that this person did this to you.
Yeah.
And I need you to know that it wasn't your fault. And so just because somebody does, let's say it does go to court and they do get a conviction, that doesn't take away the fact that all of this happened,
Mm-hmm.
that they went through this really traumatic thing. And so sometimes being able to be the only person who was supportive that did say those things to them, whether it does get a conviction or not, can be the big difference between their healing.
Yeah. Oh, I'm sure. I mean, I can't imagine being in that position. And like what a position for you to be in to be able to like be that support system for people immediately when they're still processing what's happening, for
Yeah.
maybe you might be the person to, I mean, sure they called, but like you're that point of validation and like to help name like what is actually had just happened.
Yeah. And I love being able to educate even the patients or if they do come with friends or family, because a lot of people, even healthcare workers, don't have a full understanding of the neurobiology of trauma. And
Yeah.
so there's really no right or wrong way for somebody to be reacting after any traumatic event.
Mm.
And so we get a lot of people who are like, oh, they must be lying because like they don't look like they're traumatized by anything. They're just sitting there laughing, or they're not crying. I would be crying if this happened to
Mm,
me. I would be freaking out if this happened to me, and so I think what I hope most people learn even from this is that there's no right or wrong way. Like when we go through any traumatic event, there's literally a biological reason for the way that people act.
yeah.
So we have a ton of these hormones that get released within our body, and they're, you know, catecholamines, they're cortisol, which can cause us to
Yeah.
have this fight or flight. And so we're just like so freaked out and going, every which way. There's a natural morphine in our body, opioid in our body that
Yeah.
gets released. So some people can be really, really tired
Mm,
and just like, I don't want to talk about this. I just want to sleep. Some people don't even come in
mm,
for a few days, and you're like, well, where have you been? Like what some people will be like, why did it take you so long to come in and get an exam done? And it's
yeah.
like, because they were literally exhausted.
Right.
And
Yeah.
then there's oxytocin, which is, the body's way of trying to protect itself from this very traumatic thing. So
Mm,
some people are like, I feel okay. I don't know, like, am I being dramatic about this? Is this not
mm,
something that's a big deal? And I feel okay. But then all of those hormones that do get released, what people don't realize is most damaging to the memory parts of the brain. So the
mm.
hippocampus and the amygdala. And so they come in and we start saying, what happened? Tell me exactly what happened in this exact order. And then the police come and they talk to them. Tell me what happened in this exact order. Best
Mm,
recall after any traumatic event is actually 3 full sleep cycles, because it's allowing the body to kind of reabsorb all of those hormones that have just been released. And so
right.
sometimes people will start remembering better after they've been able
Mm,
to rest.
okay.
So now they're going back into the police station. They're saying, actually, I remember this happening, and their story is changing. And
Yeah.
I'm using bunny ears with that,
Yeah.
because it's not really
It's
changing.
different
They're
then.
just remembering
Yeah.
better. And so that's where a lot of, if you have police that aren't very educated on that, now they're flipping it and they're saying, I don't believe you. You lied. You said this happened, but that didn't really happen. Did you just make that up?
Mm, that's really
So that's where
difficult.
we start getting into that victim blaming.
Gotcha. Mm.
Mhm.
So there's a lot of, I'm sure there's a lot of patient education pieces and family education pieces, it seems like, that goes in with medical examining. You had,
Yeah.
we're talking, I saw a couple posts on your social media about, you were talking about relationships and like toxic relationships and, specifically abusive relationships, people who are in relationships with narcissists and things. Do you often have conversations like how deep do you normally get with your patients? Like, do you feel like you have a space to open up that conversation with them?
Absolutely. And I never want to pretend like I'm a licensed therapist, because
Sure.
I'm not. I just see over years of doing this, the same patterns, the same
Mm,
things happening over and over again.
sure.
And so patients will make comments to me, and they're very confused, which is about like, why would he do this to me? I love him. And there was a study that was done between women specifically who were in healthy relationships and women who were in abusive relationships. And the one thing they had in common was that they both felt such strong feelings of love for their partner,
Mm,
whether they were abused or not.
yeah.
And so when you're with a narcissist, narcissism is a very involved, self absorbed, self centered um, diagnosis. So it
Mm,
is a a diagnosis, a personality disorder diagnosis, and it all stems
Mm.
from shame and fears of abandonment and, you know, all of some of these other things. And it doesn't make it right, but with a narcissist, they feel that if they are never wrong, then it's never their fault. And so
Yeah.
they will find any which way to tell their victims how them getting abused by them was their fault.
Mm.
And when you're in a relationship that continues that cycle and is almost like normalized to
Yeah.
your everyday,
Right.
it's really hard to get out of that cycle.
Yeah.
And why they would go back to that or stay in that is that it is the narcissist's job. It is their whole purpose is to
Yeah.
try and continue to keep their partner who they are abusing so confused
Mm-hmm.
and just constantly questioning that
Just
that they just
gaslighted.
don't leave, the gaslighting, but then
Mm-hmm.
also the love bombing. And so it's a whole cycle because it never starts off. A narcissist will never start off as being abusive or manipulative. It's
Mm-hmm.
always gaslighting, or
Right.
it's always love bombing. And so they're doing such nice things
Mm-hmm.
for their partner and showing them all of this love, all of these things that maybe they felt like they were missing in their life
Mm-hmm.
before they met this person. And now they found this dream person who does all of these wonderful things for them, but slowly they start seeping in some of that narcissistic behavior,
Yeah.
and it keeps escalating and escalating and escalating. And what they make sure to keep their victims tied to is how they were treated in the beginning, how much in
Mm.
love they were in the beginning, and
Yeah.
to and so after they abuse them, they'll come back. I'm so sorry. I'll never do that again. I love you so much. Here are all these gifts.
Yeah.
And it makes their victims feel like, well, I know he can get back to how he was before. And I love him so much and I've invested so much time in this relationship. Maybe I just need to give him one more chance, and then one more
Yeah.
chance, and then one more chance. And it turns into a cycle.
Yeah. Oh, yeah. That's got to be so, to be that person, talking to those people, and like it's such a pivotal conversation to have. I'm sure it's such a difficult one to, like, breach the subject of. But I'm sure,
Yeah.
like, that really, like you said, it seems like it's such a meaningful position, and that there's such a benefit for going there with them and like having those difficult conversations, like when we're able to have conversations like that with our patients, it gives us purpose, and like, you're actually making a difference, and I feel like, unfortunately, I think that that's a skill. That's a skill that might be a lost art in nursing, being able to, like, having the confidence to have those real conversations, you know.
Yeah. And I think it's like, did you see the Barbie movie?
Yeah, I did.
It almost, when I was watching that movie, it almost felt like when they're snapping all of the women out of it. It's almost
Yeah.
like sometimes you can talk to someone and they're like, I never even realized that that was happening,
Yeah.
or when they're self blaming because
Yeah.
that's what they've been conditioned to do from their abuser. Well, I made him mad. I said this. I started a fight. I went through his phone. I confronted him about this.
Mm.
And what I always tell them is would this be acceptable behavior for anybody else that you loved, like your sister or your mom or your friend?
Mm,
What would you say to them if they came and told you what your partner was doing to you, that their partner was doing to them? And they're like, oh, I would never be okay with that. And I
yeah,
was
and
like,
like,
sometimes, sometimes we, I feel like especially women are more inclined to give grace to other people and
yes.
not give ourselves the same.
Yeah, absolutely.
So yeah, so it's really is a deep conversation that we have, and not the easiest,
Yeah.
definitely.
I love how you put it, like, lifting the veil, or like, somebody just snapped out of it because they're being told that for the first time. It is scary to have those conversations. And I think a lot of times nurses kind of, because we have somebody higher up than us, that can have those conversations, we're like, we don't need to. So, like, a lot of times you don't, but like, we can too have those conversations, and we're like the more trusted profession, like we spend more times with the patients, like we we have the ability to like have those meaning, like make the you know difference, like, so it's great to see somebody who is having meaningful conversations with their patients and then truly making a difference, because it feels so good when you can say that you had that conversation and that you actually, like, lifted the veil for somebody.
Yeah, and I think it's hard for a lot of healthcare workers. Well, one, yeah, I mean, you're so busy, especially when you're a floor nurse, but everybody, there's not a single day that you will go into work that you do not come in contact with someone who has been sexually assaulted or experienced domestic violence, whether you
Mm-hmm.
know it or not, whether they tell you or not.
Yeah.
And one thing that I try to tell other nurses that are, try to educate other nurses is that
Mm.
if there is any kind of concern for abuse in any way, it's really important that we feel comfortable talking about it, because if we're not comfortable, then they're definitely not going to feel comfortable opening up to us.
Yeah.
And I think that's a big fear of a lot of healthcare workers, especially when they're going through those admission questions of, do you feel safe at home? Or in the last
Yeah.
6 months, have you been abused? I mean, what happens when they say yes? What do?
Yeah.
You always go through those questions assuming that they're just going to say no.
Yeah.
And so I think it's really important. This is such an important topic, but I don't feel like it really gets touched on even in nursing school. What do
Yeah.
you do?
So, for listeners that are inpatient bedside nurses, how do you hope that nurses would respond to those questions? If you said, "Do you feel safe at home?" and they're like, "Well, actually, no." Like, what do you think? How should people appropriately respond to those questions?
Well, especially with those initial questions, I think a lot of those should be asked separately. I feel like we're in
Yeah.
such a big rush that a lot of times you'll get the no answer because you're asking them in front of the actual abuser, like
Sure.
nobody's going to say, or in front of like family or friends.
Yeah.
And a lot of patients that are in abusive relationships, they're very embarrassed by it. It's very shameful
Mm,
to them. And so they won't say anything. So making sure that you're asking, especially that question in private, is so important.
yeah.
If they do say yes, then making sure that you're getting in touch with social work
Mm,
and saying, can you tell me a little bit more? When was the last time were you physically assaulted? Is it verbally assaulted, abuse?
yeah.
Because I think some people won't really consider verbal abuse to be abuse.
Yeah.
A lot of patients will say, if I'll ask, have they abused you before? And they're like, well, maybe. And I go, tell me more about that. And
Yeah.
they're like, well, I just didn't come in because I didn't think it was bad enough. So they're
Mm,
putting this hierarchy on abuse now that, well, if it's verbal, then he didn't really physically hurt me, but I don't think people realize the psychological effects of what verbal abuse can have on somebody.
Yeah.
So abuse is abuse. And if it's something that they're trying to get out of, especially if they're with a narcissist, or let's say like someone with a antisocial personality disorder, like a sociopath, it's very dangerous if they decide to leave. So that is when they
Mm,
need our help the most. Some people aren't ready to leave because of a whole list of reasons, like finances, or what if there's children involved and people say, get those children out of there? They don't realize within our court system, even if there is
yeah.
documented abuse from one parent to the other, they still believe that it's important for a child to have both parents. And so now you're having, your child alone with this
Mm,
person who's an abuser.
ugh,
And so they decide not to leave, for the kids,
yeah.
because they don't want to leave. They would rather be the brunt of the abuse as opposed to leaving their child alone with a narcissist.
Mm,
So if they do say yes to the abuse question, definitely getting involved with social work, making sure that social worker is actually educated in the realm of domestic violence, because sometimes they're not.
okay.
Um, and every single state will have some kind of advocacy group, community advocacy group for domestic violence or sexual assault. And they might be miles and miles away, especially for people who are living out in rural areas.
Mm,
But making sure that they have some kind of point of contact to say, hey, when you're ready to go, when you're ready to fight this,
yeah.
give these people a call, and maybe they can help you.
Mm,
And also, especially, this is a perfect time for them to get in touch with an advocate, because the abuser isn't going to always be in the hospital. So they actually have time to be alone. They have access to a
yeah.
phone. They
Yeah.
have access to a phone. They can, if they're not going to leave right away, they can at least come up with a safety plan. And that's
Sure.
most important, especially when leaving a domestic violence relationship, because
Mm-hmm.
that's the most dangerous time, is when they decide to leave. That's when we actually see the homicides
Gotcha.
happen.
Okay.
Yeah.
So maybe, and I mean, every situation seems like so tumultuous, like maybe people don't also reach out because they don't think that they are ready to, like, up and leave. And so maybe just, I'm sure that's a situation that these like advocacy groups see all the time. So it's not like, the victim has to have all of their ducks in a row, like ready to go in order to get help. Like this is a group to help them, like, understand what their options are and just get their foot in the door of changing, what they need to change.
Yeah, working towards that.
Yeah.
And yeah, definitely, because it having a plan is so important, especially when kids are involved, because you need somebody that's going to know the legal system and have access. Sometimes they don't have access to lawyers, right?
Yeah.
Who can afford to get a lawyer, especially if you
Yeah.
don't, if you're in a relationship where you don't have a job, you have to rely
Yeah.
completely financially on your abuser, you don't have a car, you don't have a phone, they've taken your phone away.
Mm-hmm.
You have literally no access to the outside. So
Yeah.
actually being in the hospital is the best place for them to get screened and actually find out if that's something that they're in.
Yeah. So it's such a crucial time for these people. And I think also
Mm-hmm.
just, in setting up those conversations, it sounds like just, if you're the nurse taking care of somebody that like gave you the green light of like, yes, this might actually be a problem, just like maybe taking a beat and like showing like that concern and like,
Mm-hmm.
like isolating those questions so that you're not like, okay, did you just have a bowel movement? Like, what are your allergies? Did you like, have you ever been on isolation? Have you ever been hit at home? Like,
Yeah,
like
yeah.
maybe like using just like, okay, now we're going to talk about some sensitive topics, like,
Mm-hmm.
and then maybe go into it. And like, if they say yes, like show your concern and like, give that person that space to open up to you and like be in that vulnerable, environment.
Yeah, and I think that people don't realize just how vulnerable these patients are because they're sitting there in a bed naked under their hospital gown, and then they have
Yeah.
somebody hovering over them, talking to them, asking them all these very personal questions. I think there's a lot that more that people can get if they were to pull up a sitting stool and come down to their level to where they
Yeah.
are. There's a lot to that because it's not doesn't feel good when someone's hovering over you.
Yeah.
Also, letting them know that you care. A
Yeah.
big talking points in these abusive relationships is, or even sexual assault is, go ahead, tell someone. They're not going to believe you. They don't give a,
Yeah.
they don't care about you. They're not going to do anything for you. And our
Yeah.
job is to make sure that we prove their abuser wrong, that
Yeah.
there are people that care and there are people that will believe them.
Yeah. It's such a powerful job. So, walk me through like what a typical patient interaction looks like for you from, when you get a call to, when it ends.
Sure. So I work in the emergency department. So I'll get called for we'll say sex assault. Um, because the reporting options are a little bit different depending on the type of assault and then also the state that you're in. So
Mm-hmm.
I'll just go based off of Colorado, which
Mm-hmm.
is where I'm currently at, just because I know the reporting options here.
Mm-hmm.
So when I go to see a patient, if they were sexually assaulted, they have to have been sexually assaulted within the last 7 days in order
Okay.
to have an exam done. So you don't have to, if it's been more than 24 hours, that's fine.
Mm-hmm.
Um, you can still come in.
Okay.
And at my hospital, it's up to 7 days. But if you just go across into the next county, it's 5 days. So it all has to do with funding.
Okay.
Um, Now, for domestic violence, they have to have been strangled in order to see a forensic nurse. And it has to have been within 72 hours of the strangulation. And that's
Oh,
because statistically, DNA starts to deteriorate after 72 hours.
okay.
And because it's touch DNA, it's a little bit more difficult to get because it's strangulation, so it's touch DNA as opposed to for sexual assault. There's semen
Okay.
or saliva, things like that.
Is that pretty
So,
much the difference between the two camps, like forensics
uh,
and sexual assault examining?
yes,
Okay.
yes. So, um, but if you go over to the next county over, they'll do strangulation kits up to 5 days.
Okay.
It's yeah, so
Arbitrary.
it's really it honestly, it's so confusing even to patients. And then if you go to some hospitals, they don't even have a same, so then they say you got to go over to this hospital instead.
Mm,
So imagine like you were just like assaulted and you go into a hospital and they're like, we can't help you here.
already.
Um, which
Yeah.
is just mind blowing.
Yeah.
So, yes, so I'll go and see a patient. We'll say that this is for sex assault, just for purposes of the exam. And we'll say this was a sex assault with strangulation. So I go in, and in Colorado, we actually have 3 reporting options, which is a lot more than a lot of other states. So there's the original first option, which is the law enforcement, where there's a full investigation, police are involved, and there's the
Mm-hmm.
whole thing of investigation done.
Yeah.
Then there's the anonymous, where police do not see your name. They don't know any identifying factors. We collect
Mm,
the evidence. It goes to the crime lab, but it sits on a shelf until they are ready for it to get processed.
okay.
In Colorado, we have a third option. It's called a medical report. And that's where people can come in, get an exam done, have evidence collected and photos, and then it goes to the crime lab and they will process the kit. But there is no investigation, there's no police involvement, and they can get the results of their kit back. And
Oh,
there's
okay.
different reasons for people wanting to do all 3 of those those options. No, those options are not available for just domestic violence. And I don't want to say just as
Okay.
in it was just domestic violence, but if the sex assault was not involved, for somebody who is strangled, they have to have a law enforcement reporting in order to get evidence kit collected.
Okay.
And
Okay.
I feel like I go on a separate tangent about that. So I'm going to get back to the
Yeah.
topic at hand. So I go over their reporting options. And then I will also, we can also offer them prophylactic medications. And that's if there was any kind of penetration that was done, like
Okay.
penile penetration.
Sure.
So we can offer medications for STDs, and we cover the three main ones, which are trichomonas, chlamydia, and gonorrhea. We wouldn't do Typically, we would not do an STD test because statistically they would not show up on a test for about 2 to 3 weeks,
Okay.
STD. So what we do is prophylactically treat, and then they can follow up in our sexual health clinic
Okay.
in 2 to 3 weeks. We'll also cover, if it's been within 5 days or 120 hours, we will prescribe a medication called Ella, which is our Plan B. It's actually a
Okay.
more effective Plan B, and I think that it would be better if a lot of other hospitals would switch to it. It's a little bit more expensive, but it doesn't have as low of a threshold for people with a larger BMI.
Okay.
Also, it doesn't matter where you are in your cycle or anything like that. It just covers. It's better coverage
Okay.
for pregnancy prevention. Next, we also prescribe a medication called NPEP. It's 2 pills, 2 different medications that help to prevent HIV. And that has to be started within 72 hours of the assault. So if we're
Okay.
outside of those timeframes, then we can't prescribe those.
Okay.
So we offer those medications, and then I'll kind of, once I figure out which reporting option they want to do, we'll go back to my office, which is like tucked in this back corner. So it's very quiet. It's very quiet,
Good.
very secluded, which I think is what you really need, especially when you're
Yeah.
talking no interruptions.
Yeah.
And so we just kind of do like a talking part first where we go over their past medical history, and we talk about any medications that they're on, and to make sure that these medications aren't going to affect anything or
Interact. Yeah.
interact. But then we get to the part where they tell me what happened. And what I'm looking for as a forensic nurse is more so what happened during the actual assault. Because in my mind, while they're telling me, it's going to help drive my exam. So,
Yeah. Right.
trigger warning here. If they tell me they put their mouth on my neck and then they ejaculated in me, and then they grabbed and squeezed my arm really hard here, I'm thinking about, where can I find saliva? Where
Yeah.
can I find skin cells? Where can I find ejaculant? One person I actually saw, she was like, yeah, he cut himself accidentally on something, and there was actually a drop of dried blood on
Wow.
her. So I'm looking for any kind of DNA fluid.
Yeah.
And so from that, I'll go over their options with them, like for swabs. And I
Mm-hmm.
think it's really important for everyone to know that just because you agree, just because you're consented to do this, does not mean that you have to do every part of this exam. This is
Mm.
not to further traumatize somebody. So
Yeah.
I make it very well known that I'm going to ask you before I do anything. And if you don't want me to do it, we don't have to. If
Yeah.
at any point during this exam you want me to stop, I'm going to stop. I
Yeah.
can't undo the evidence that I've already collected, but I'll just package it up and it'll go sit on a shelf for up to 2 years here in Colorado.
Yeah.
And at any time they want that process, they can.
Mm.
So I think a lot of people feel like, well, if I go in, then I'm going to have this done, or I'm going to have to talk to police, or I'm going to have to, you don't have to do anything. You don't
Mm-hmm.
have to do anything.
Mm.
So I go through, I make sure that they're okay with the swabs that I would like to collect based off of what they've told me. And
Okay.
then I'll do a full head to toe, because sometimes during these assaults, they don't realize that, oh, they scratched me across my back,
Mm.
or they actually squeezed my leg here and I have all this bruising. So we'll do a
Mm.
head to toe. Our main goal as forensic nurses is not evidence collection. Our main goal is to make sure that they are medically cleared and that they are medically safe. And
Mm.
so I go through, and if you've ever seen in the movies, the pictures with the ruler, that's also what we do. So if we see
Okay.
any bruises or abrasions, but also if we see something that's concerning us medically, then we can bring that up to the ER physician.
Sure.
So making sure that you're doing a good head to toe is really important.
Yeah.
And then we also do vaginal exams and for
Mm-hmm.
females. And so we can do a speculum exam. I will
Okay.
gauge with the patient if they are so traumatized at the moment. I'll give them the option of a blind swab. Now, it's not
Mm.
as good as doing a full speculum exam. With the speculum, it helps to pool some of that evidence so that when you do go in with the
Mm.
swab, you know what you're getting,
Okay.
opposed to a blind swab is no speculum and you're just putting
Yeah.
the
Going in.
Q-tips in.
Yeah.
And then also, if it was, let's say, a digital penetration, so finger, the assailant has
Mm.
stuck his fingers inside. Sometimes, not all the time, sometimes you can actually see nail marks on the vaginal walls, and so that's just like
Mm.
further evidence to collect of photos.
Okay.
Now, people will always say, well, if there was no external trauma, then maybe it didn't actually happen. And that's not true.
Right.
The majority of patients that come in will actually not have any external genital injury or vaginal
Mm.
injury. And if you think about it, vaginas were actually made to go through, they can hold a lot of trauma. They go through
Yeah.
childbirth.
Right.
Just because somebody doesn't have external injury does not mean that we believe them any less.
Right.
So then
Mm.
afterwards, we kind of have that conversation. Do you feel safe going back home? Do you have a safe place to go? And if they say
Mm.
no, then we're talking with social work and trying to figure out how can we provide them with a safe place? What is possible?
Yeah.
And sometimes it's not. Sometimes we don't have any resources available.
Mm.
Everything's filled up. That's been a consistent issue, especially here, is that you'll call all of these safe houses, especially if it's a domestic violence situation. All of the safe houses are full. And that should
Yeah.
be very telling of how prevalent this is and what an issue this is.
Right.
So we try our best to give them as many resources as we can, get them set up with an advocate, a community advocate, or even the police
Mm-hmm.
advocate, depending on if they're deciding to report or not.
Mm-hmm.
And then making sure that medically they're okay. And then we'll take them back to the emergency room and then they get discharged from there.
Okay.
And so that's kind of the process. It does not go quickly. People
Sure.
think, oh, I can just come in, swab, and go.
Mm.
These exams can sometimes you'll be at the hospital for 3, 4, 5 hours.
Yeah.
It's not a quick thing to go through. And so that's where we also come in to say, if you're hungry, eat. If you're thirsty, drink. If you need to
Yeah.
use the bathroom, use the bathroom. There's this misconception that, we're putting all of this DNA above everything else. And what we really need to do, especially as healthcare workers, is making sure that we're putting the patient's comfort before anything else and
Yeah.
making sure that their needs are being met, because that's our ultimate goal. We're healthcare workers. We're not detectives. We're not law enforcement. We're not the district attorney's office or prosecutors.
Right.
We're nurses first
Yeah.
and foremost. We want to make sure that that patient is medically okay.
Yeah. You said in the beginning of our conversation about when you were working on the advice line, that you had these misconceptions of like what to say to these patients. So what now? Like, what are some of the biggest things that you have learned that I guess, what are some of the biggest misconceptions or like things that you have to, you know, um, educate patients about, mostly about like your exam and your experience with them?
Yeah, just making sure that they know they can eat or drink,
Mm-hmm.
that they don't have to bring their first urine with them because a defense attorney would just say, well, we don't know whose urine that is, and they would discard it. They would get it thrown out.
Mm,
And so it's really important that we collect it in the hospital. And it's okay to pee. We don't want you holding onto your urine because this could literally take hours. It's okay to bring somebody with you. I know that it was a little dicey around COVID time when they were only
mm,
allowing some, certain amounts of people in, but we really do encourage people to have a friend with them that they feel comfortable with. You don't have to um sorry, if you do wait, if it's been 1 or 2 or 3 days, that's okay. You can still go in.
mm-hmm.
Again, we see people up to 7 days post
Yeah.
sexual assault. And in that time, people have been eating, they've been drinking, they've been peeing, they've been showering, and it's
Yeah.
still possible to get DNA match because
Right.
DNA is actually pretty resilient.
Mm,
So I think going in, especially if they do have a medical reporting option,
mm,
and knowing that you don't have to talk to the police if you don't want to. There are other options.
mm-hmm.
That's another misconception. You don't need to talk to the police. Um,
Okay.
so I I want people to know that just because their case doesn't go to court doesn't mean it was all for nothing.
Yeah.
A lot of the times people who sexually assault, they don't just do it one time. It's not about sex
Yeah.
to them. It's about power and control over another person. And so the only way that we can actually get somebody that someone's actually going to get a conviction typically is if there are multiple people that they've done it
Yeah.
to. And the only way to find that out is by people coming in and reporting it
Yeah.
and at least having the evidence collected, because that way they can at least run it through the CODIS system. And then that's how you get the matches.
Yeah.
And so I've watched some documentaries that are really interesting where they've actually been able to take somebody's sexual assault kit and run it through the system and solve cold cases from murders, from other rape um, assaults, and actually find people and solve these
Wow.
cold cases. And so it really does make a difference,
Yeah.
can make a difference whether it's immediate or let's say it's even 10 or 20 years from now.
Yeah.
That's still in the system. I also want people to know when you do go forward, we do collect your DNA for evidence in order to differentiate the difference between your DNA and anybody else's. But
Mm,
there are strict laws, because I know this happened in California. There are strict laws that those databases are supposed to be kept separate. So
mm-hmm.
your DNA is not kept in the system. It cannot be used against you
Sure.
in any other case.
Gotcha.
So, yeah, I think there's so many myths and misconceptions out there. If you bring your clothes in, we do offer to collect clothing. I think the underwear is
Mm,
probably most important,
mm-hmm.
but if you don't want to give something up, and people will say, well, that's so strange. If you were sexually assaulted in that, how can you still wear that? It doesn't matter. Sometimes that's somebody with somebody's favorite outfit. That was their most favorite outfit. Somebody gave that to them as a gift, or that was a really expensive outfit.
Yeah.
It doesn't have to, what I tell patients is you don't have to give up your clothes.
Yeah.
Because there's a chance you might not get them back.
Yeah.
And
Right.
so if it's something that you don't want to give up, you don't have to. But also, this person that just sexually assaulted you just took away so much from this person. They
Yeah.
took away their power and control, and we're not going to let them take any more from them. So if this is their favorite outfit, that's going to
Yeah.
continue to be their favorite outfit. If they were at a concert and this happened, I encourage them to still go to concerts if that's what they enjoyed doing.
Yeah.
You do not allow this person to take any more away from you.
Yeah.
And that's how you're going to heal. That's how
Yeah.
you're going to move forward
Yeah.
after this.
Yeah. That's yeah, I can't. It's such a difficult topic. Like I found myself like lost for words so many times. It's just like I can't imagine somebody like judging somebody like why wouldn't you allow them to take the, it's like that's just so wrong. Like obviously this person is in like such a horrible like position, and like they're not in the position to be judged over like
Yeah.
their decisions in the time. It's just that's lost on me.
Well, I think it's a lot easier for us to think just in general as people. We like to think that we would always know what to do in any situation. This is what I would do. But
Yeah.
you've actually been in that situation, you really don't know.
Right. Yeah, definitely. So I want to kind of close out the episode with just what kind of characteristics do you think a nurse would, characteristics that would make a strong forensics nurse? If there's some people that are interested in pursuing forensics nursing, like what type of, skills, a skill base is good for forensic nurses to have?
Yeah, I think first and foremost, someone who is able to absorb a lot of very heavy trauma and not take it on as their own. You need to be able
Mm,
to separate that.
yeah.
Um, if a lot of people want to go into this field because they were sexually assaulted in their past and they want to make sure that other people have a good experience when seeing
Mm,
a sane nurse. But this isn't about you. So you really need to be able to separate that.
yeah.
Somebody who's also a very good listener, someone who is not judgmental at all. And a lot of my friends will be like, you are so naive. You believe everybody. And it's because what does it matter?
Yeah.
I look at myself and I don't think that my opinion on a lot of things really matters. Uh, I look at a lot of things and I don't feel like that's that big of a deal, because there's
Yeah.
other people, in general, like in my general life.
Mm,
I don't feel like, oh, well, that wasn't that big of a deal. I'm not going through this. So,
yeah. Yeah.
it's definitely, I think somebody that has a lot of patience, because you'll have a lot of patients that will, go off on tangents.
Yeah.
They're in that fight or flight. There are some patients that are having a ton of
Mm,
emotion, and maybe they'll cuss you out.
mm,
You never would think as the same nurse, like, I'm here trying to help you and you're cussing me out. It's not about you.
yeah.
You don't take it personally.
Mm,
They've just been through something completely traumatic. And so I
yeah.
think it's being able to separate yourself from that as well, and
Yeah.
be able to go forward instead of being like, well, fuck you too. Like it's not about you.
Yeah.
um, so yeah, and just being able to sit and listen,
Yeah.
but also help to redirect
Sure.
when needed. So I
Sure.
think those characteristics, and then also being very organized. I will tell you,
Mm,
in my home life, I am not organized. My place looks like um, an explosion went off in here. So I think I've had that box sitting there for a solid 5 months.
Oh, I got the same thing
Don't
in
know
my
what I'm doing with
bedroom.
it. When I'm at work, I am one of the most organized people. I am so type A. I have to do things in a certain way. So I think, those
Yeah.
people that you're a little bit of both, because sometimes it's not going to go in order of A, B, and C,
Yeah.
but you need to be able to be organized enough to make sure that you're getting everything
Okay.
situated.
Yeah. You were talking about how, the job requires patience. I think it's probably nice that, you're focused. You have no other focuses except for this one patient. Like you can really be present in the moment with those people, which is, definitely a change of pace as far as like inpatient bedside nursing. You have all these other like responsibilities, but to just like be able to focus on that one, like I'm sure that's nice.
Oh, 100%. And I think the struggle is when you do have multiple patients that are waiting, you hate to make
Mm,
patients wait. You're the only one, but
yeah.
you know that when it's that patient's turn, they're going to get your 100% attention.
Yeah. Yeah. Do you normally have like patients back to back?
A lot of the times when I get called in, whenever I'm on call, I'll have typically at least one patient, if not two. The
Okay.
most I've gotten done in a 12-hour shift is 5 patients in a row. So if you can
Wow.
imagine, they are sitting there for how many hours
Yeah, waiting to
before I
see
was able
you.
to get to them. Yeah. And that's the other thing is bring a book with you,
Mm,
because you never know how long it's going to take. And we really do try our best to get to you as fast as possible, but typically we are one member team.
yeah.
There's only one at a time because which this is a whole nother thing I could get into, but we don't typically bring in revenue to hospitals. So that's why
Mm,
SANEs are not everywhere because hospitals do not see the value. A lot of hospitals don't see the value in
mm,
hiring a SANE nurse. They're like, oh well, if they come in, then we'll just have them take out this book that's been collecting dust and you'll have somebody
right.
who is
Step
not
by
trained at
step.
all
God.
collecting all of this evidence and trying to talk to patients with what they've learned on Law and Order SVU.
Yeah, right. Take your urine and don't shower for
Take
5
your
days.
urine. Yeah,
Oh my gosh. Well, Leah, this was such a great conversation and thank you so much for what you do and like the information that you share and spread and your authenticity and you're doing good work, on social
thank
media
you.
and at the bedside. So, I appreciate you explaining all of this, being an ambassador for forensics nursing today.
Thank you so much for having me.
Yeah. So where can people find you? We want to plug your Instagram. Anything else you want to plug
Yes.
too? Feel free.
I haven't really figured out TikTok with their algorithm. I'm mostly on Instagram. I do have a Facebook. Anything I post to Instagram just gets posted
Yeah.
to my Facebook. But Off the Clock Nurse on Instagram and Off the Clock Nurse on TikTok, and then Off the Clock Nurse Travels on Facebook. Back from when I was still traveling. I haven't changed the name of it. It's just going to stay that way. So.
Yeah.
Um, yeah, but I do have a little highlights on my Instagram that says F&E Sane, and it's all information pertaining to sexual assault and domestic violence and human trafficking.
Cool. All right, Leah. Thank you so, so much. I'll talk to you soon.
Thank you.
That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubin and Sam McKay, and Aiden Dykes for the music and editing. Until next time, take care of yourself.